Hey, Dr. Patel here, and what we're talking about right now is chin lipo or submental liposuction. So what in the world is it? If you've ever been bothered by your double chin or feel that your profile view, you have a lot of fat here, and no matter how much you work out or no matter what you do, you can't get rid of that, there's a couple things you can do. So first, let's talk about things that I don't recommend. So there's two things out there that have been popularized because they come from big companies that spend a lot on ad revenue, and that's going to be Kybella and Cool Sculpting. Kybella is a detergent that you can inject that slowly melts the fat. You need about 3 injections, and each injection is going to cost about $600, $900. And after each time, you're going to swell up like crazy. 4% of people get a nerve injury where their nerve droops afterwards, and it creates a lot of scar inside. Last but not least, you only inject it here. It doesn't define the jawline, and it doesn't tighten the skin. Cool Sculpting, similar. You can only do it here. It works a little bit better in my opinion, and you do have a little bit less long-term swelling, but the costs are similar, and generally you don't have to do it 3 times, but once again, you won't get any jawline definition. Now, to me, the most important thing when people come to me and say, I want to look like I look in my selfies when I'm turned and have a nice defined jawline, is getting that jawline contouring. Removing the fat is not of utmost importance. For most people, we want them at their ideal body weight before the procedure. We want them at a stable weight. What we really want is to remove fat, but then tighten the skin and be able to pull it back. And the way we do that is by 3 separate incisions. 2 incisions the size of this pen below each ear, and 1 half the size of my pinky right in the middle in the crease over here. Through those incisions, we're able to access and contour all the fat below the jawline. We can't go above, unfortunately, because of the presence of some nerves. We're able to get this nice and tight. When it comes down to it, we're not removing a crazy amount of fat in the average patient. It's anywhere from 15 to 45 cc's, which if you've heard of body liposuction, that's very, very little. Now, what's the technique we're doing to do that? So first of all, you do need to be in the operating room, and you do need to use a suction machine, but we do begin by numbing you. We use about 50 cc's for the average person of a light anesthetic solution that we're injecting throughout the neck to get it nice and swollen and to allow us to extract that fat gently. And then we first pass a cannula in without even having suction attached, just to create a layer so your body knows where to scar down, and then we use the cannula to remove the fat below that. The most important thing is the quality of your skin. Part of that assessment will be me figuring out what your skin's like and how likely it is to tighten down. And once we're able to do that, we're able to determine how long you need to wear a head wrap on afterwards. For the average patient, I recommend 1 week with it on 24 hours a day and 1 week with it on as soon as you get home every day, and then hopefully as much as you can after that, going past that. If you have any questions, the overall downtime is about a week with the head wrap on. It takes about 3 months to see results. You'll start seeing some significant improvement in the average patient in about 6 weeks. If you have any questions, feel free to reach out to our office.